Welcome to this explainer. Today we're looking at what is honestly one of the most incredible medical transformation stories in human history. We're taking a real deep dive into HIV and AIDS. Not so long ago, a diagnosis carried just an immense amount of fear, uncertainty, and stigma. But modern medicine has entirely flipped that script. Today, this isn't a story of despair at all. It's a powerful narrative of scientific triumph, resilience, and modern empowerment. So we're going to decode this science, clear away the misconceptions, and discover exactly how evidence-based care has literally turned a cellular heist into a condition for lifelong health.
Okay, let's dive into this. Here is our clinical roadmap so you know exactly where we're headed. 1. Understanding the HIV virus. 2. How HIV progresses. 3. The power of treatment. 4. Prevention and protection. And finally, 5. Thriving with HIV today.
All right, let's kick things off with Section 1, Understanding the HIV virus.
If we trace this history back a bit, there is a stunning, high-contrast shift. We started in an era marked by the initial discovery of the HIV global epidemic, a time of really intense medical mystery. But think about how quickly science mobilized. That urgency led to the rapid development of HIV testing, which was then followed by the groundbreaking evolution of antiretroviral therapy. Today, we're in an era defined by massive, highly coordinated global control programs led by organizations like the WHO and the CDC. We've gone from basically scrambling for answers to actively managing and controlling this virus on a global scale.
Now, before we go any further, we absolutely have to clear up a fundamental confusion that honestly still exists today. HIV, or Human Immunodeficiency Virus, is the actual virus itself, the pathogen that enters the body and attacks the immune system. AIDS, which stands for Acquired Immunodeficiency Syndrome, is not the virus. It is the most advanced, severely immunocompromised stage of an untreated HIV infection. Put simply, you can have HIV for years and years without ever having AIDS. And with modern medicine, the entire goal is to ensure the virus never reaches that advanced stage.
Moving on to Section 2, How HIV progresses.
So here is exactly how the virus hijacks our immune system. HIV specifically targets CD4 T cells. These are essentially the commanding generals of your immune system. There are 5 highly coordinated steps to this viral life cycle. First, the virus attaches and fuses to the CD4 cell receptor. Second, in an incredibly sneaky move called reverse transcription, it converts its RNA into DNA. Third, it integrates that brand new DNA directly into the human host's DNA. Fourth, it uses the cell's own machinery for replication and assembly of new viral parts. And finally, step 5, the new virus buds out and matures, ready to infect the very next cell. Without medical intervention, this cycle just constantly destroys the CD4 cells, gradually wearing down our immune defenses.
Now, what's really interesting is the exact medical toolkit doctors use to track the virus and counter its progression. We aren't just guessing anymore. If a clinician wants to screen for an infection, they use a rapid test to look for antibodies or antigens. If they need to confirm the actual presence of the virus itself, they use a PCR test. And to monitor the ongoing health of a patient, well, they look at the CD4 count to measure the exact strength of the immune system, and they measure the viral load to see exactly how much HIV is circulating in the blood. These tools basically give us a perfectly clear window into the microscopic battlefield. That brings us to Section 3, the power of treatment.
The absolute cornerstone of this medical miracle is ART, or Antiretroviral Therapy. These are medications that suppress viral replication, restore immune function, and prevent transmission. Remember those 5 steps of the viral life cycle we just walked through? Well, different classes of ART, like reverse transcriptase inhibitors or protease inhibitors, are specifically engineered to throw a massive wrench into those exact steps. They literally interrupt the virus from copying itself. When taken consistently, the virus is completely suppressed, which gives the immune system time to rebuild and restore its CD4 cell count. So, the absolutely crucial point here is U equals U. Undetectable equals untransmittable. If a person living with HIV takes their ART daily as prescribed, their viral load drops so incredibly low that standard tests can't even detect it in their blood. According to current medical evidence and clinical guidelines, maintaining this viral suppression means there is effectively zero risk of sexual transmission to a partner. This isn't just some abstract clinical fact, it is a monumental, stigma-shattering reality that brings immense hope and freedom to millions of people. Let's ground this clinical data in a real human scenario. Consider this case study. A young adult who goes in for regular testing and gets diagnosed early, right during the acute HIV infection stage.
Because they tested early, they know their status right away, and under current guidelines, they start ART immediately. Because of that early intervention and their strict daily adherence to the medication, they quickly achieve an undetectable viral load. Their immune system remains strong, they won't develop AIDS, and they cannot sexually transmit the virus. They have taken immediate, complete control of their long-term health. It's a total game changer.
Now for Section 4, Prevention and Protection.
First off, let's do a quick pattern interrupt to address a very persistent, completely false myth. Can you get HIV from a mosquito bite? The scientific definitive answer is no. Absolutely not. HIV cannot replicate inside a mosquito, and the insect's anatomy simply doesn't allow for human-to-human transmission of the virus.
And this brings us to a really vital comparison. Actual modes of transmission include unprotected sexual contact, sharing needles, or mother-to-child transmission during pregnancy, childbirth, or breastfeeding. What absolutely does not cause transmission are the myths that unfortunately still drive unjust social stigma. HIV does not spread through hugging, handshakes, sharing food, sweat, tears, or any kind of casual contact, period. By clearly separating the hard facts from the fiction, we can focus our energy on the real public health strategies that actually work.
Two of the most incredible preventative tools we have today are PrEP and PEP. They sound kind of similar, but they serve very different functions. PrEP, or pre-exposure prophylaxis, is a proactive daily medication taken by people who do not have HIV but are at high risk, acting as a powerful shield to prevent the virus from ever taking hold. PEP, on the other hand, stands for post-exposure prophylaxis, and that is an emergency response medication taken after a potential exposure to the virus, like, say, an occupational needle stick injury or a condom breaking.
And this brilliantly illustrates the sheer urgency of PEP 72. That is the maximum number of hours you have to start PEP after a potential exposure for it to be effective. It is a strict medical emergency. If started within that 72-hour window and taken consistently for the prescribed course, it is highly effective at preventing an HIV infection from permanently establishing itself in the body.
We also have incredible protocols for protecting the next generation. Take this case study. A pregnant woman living with HIV. By engaging in routine testing and using ART consistently throughout her pregnancy, childbirth, and by following specific infant prophylaxis guidelines, she can safely prevent mother-to-child transmission. The baby is born perfectly healthy and HIV negative. Science has literally made it possible for people living with HIV to build healthy, growing families without fear.
Let's move to our final chapter, Section 5, Thriving with HIV Today.
Modern care requires a highly holistic approach. While antiretroviral therapy is the absolute medical foundation, true health goes way beyond just taking a pill. Thriving with HIV involves balanced nutrition with adequate proteins and vitamins to support natural immunity. It involves prioritizing mental health, seeking psychological counseling to manage anxiety, depression, and to combat the social stigma we talked about. It also involves physical rehabilitation and physiotherapy to manage any potential side effects like neuropathy or muscle weakness. It's about treating the whole person, not just the virus.
And the result of all of this? Life expectancy can approach that of the general population with sustained treatment. That is absolutely phenomenal. It completely rewrites the story. Untreated HIV can still progress to AIDS and life-threatening complications, yes, but with early diagnosis, strict medication adherence, and comprehensive holistic care, HIV is no longer the inevitable fatality it once was. It is a manageable chronic condition. People are living long, productive, vibrant lives today.
We've journeyed from understanding the cellular mechanics of the virus to witnessing the life-saving power of art and modern prevention tools. The science is crystal clear, the evidence is incredibly robust, and the path to thriving is well lit. But the biggest barrier that still remains isn't medical, it's social. So I want to leave you with this final, provocative question. With HIV now a highly manageable condition, how will you use this knowledge to help end the stigma today? Education and compassion are just as crucial as medicine. Thank you so much for joining me on this explainer, and I truly hope this empowers you to be a voice for evidence-based care in your own community.